Blue. I can't hear you.
Now I'm not muted.
Yay.
It was telling me I was muted, but it's like, where the hell is the control?
Yeah, mine's at the bottom, but yeah.
So now I got to figure out, why am I back over here? That's weird. You can still see my slide, right?
Yep, I see slide. Asymptomatic spread of COVID-19.
Yeah. So if I pull up this, you see that slide now?
No, I'm still seeing the topic 14.
Okay, that's what I got to figure out how to do. That's the video I'm trying to show you. So if I go back here, the only, how do I switch screens? I think the only way I have to switch to that is to pull it up again. See, I see it on the same screen.
Yeah, I'm still seeing just the slide.
Swap presenter view and slideshow. What's that do? Now what do you see?
Now I
You just
see,
move the slides to the other page.
yeah, it's like now it's just as if you're not in slideshow. Now you're in slideshow.
So if I minimize the slideshow, pull up the video. Do you see the video?
Yeah, I think you'll have to stop share because it's still showing. Yeah, even though you've switched screens, it's still showing that main screen.
Yeah. So
we can't hear you, Brenda.
So let me see if I stop share.
That's because I was muted.
I'm gonna stop sharing and
see right
if I pull up the video. Share web browser. Do you see the video?
It says it's starting to share content, so it's pulling it. It's thinking. I can see it thinking.
I don't think I want to do that.
There it is. Nope. I wonder, Brenda, do you have the video pulled up on your end? Can we make you a presenter for one part?
If you see, now you see the video, right?
Yes, I do.
Yes.
So let me see if I can switch to the slides and see if it works that way.
No, I do not have the video pulled up. I can pull it up, but
What do you see now?
still the same slide, episode 24.
Buggers. Okay. There's got to be a better way to do this. And now I got to figure out how to get back to my I got to see what I'm looking at. Okay, I'm just going to leave the slides up for now, and then what I'll have to do is I'll have to stop sharing, pull up the video, and I'll just do it that way. It happens pretty quickly. I just have to be able to make it work.
Hey, welcome everyone. My name is Brenda Groves. I will be helping facilitate in the back end. So welcome to our second Project Firstline session. Again, if you could type your name and organization in chat, that will help us to keep accurate attendance records. If you need anything or have a comment throughout the session that you would like to just put into chat, I will be monitoring that, so feel free to use it. At this time, I will pass to Miss Nadine.
Good morning, everyone. Welcome to our second Friday Project Firstline training. And I'm going to, for those of you who actually paid attention to the agenda and what we were going to cover on each Friday, full disclosure, your trainer, me, last Friday, got a little confused and probably got a little ahead of horse on what we were supposed to cover today. However, the CDC has added this particular module, which actually has relevance when we talk about the videos that we watched last week. This particular training session is one that lends itself well to what we're going to do today. So the first thing before I get into the slides today, in thinking about last week's sessions videos, how can you, and I welcome you to type this into the chat, and the Brendas are going to monitor the chats because I can't see those when I'm in presentation mode. But in last week's sessions videos, how could you use what you learned to explain the concepts to others? Do you think that do you get put into situations now where you could use some of what you learned last week to help them understand and answer their questions? And like I said, I can't see chat, so I'm dependent on the Brendas to tell me if there's anything in chat. I'm assuming silence means none. So today we're going to review how viruses work, how they can be spread even when an infected person doesn't feel sick, and we'll have the opportunity to discuss and reflect together before we wrap up for the day. So we have a couple objectives today. Explain how a person can be infected with SARS-CoV-2 and not feel sick, but can still spread the virus to others, and discuss one reason why infection control recommendations for COVID-19, such as masking for source control, are in place in healthcare settings. And I know many of you are probably coming up on the firing squad. You feel like you're on the firing squad for having to enforce things like masks with your folks, but we're going to talk about that today. So after today, you'll be able to explain how a person can be infected with SARS-CoV-2, not feel sick, but still spread it to others, and discuss why the infection control recommendations are helpful. So this slide talks about a poll, so I'd really like you to type into chat your responses. If you can answer the questions considering your experiences in your work life, and tell us what apply, that you work in a facility or a situation that has treated people with COVID who were very sick, people with mild symptoms, or people with no symptoms. If you could just put into chat very sick, mild, or no symptoms, that would be helpful at this point.
And Nadine, they're not seeing the slides.
They're not seeing the slides.
No, we're on the landing page with the attendees.
Oh, Jesus.
But I do have one response so far, and that is very sick.
Okay, are you seeing PowerPoint now? Just not in presentation mode?
No.
Okay, are you seeing it now?
Yes.
Okay. Now you should see it in presentation mode.
Yes, ma'am.
Sorry, guys, technology is not our friend lately. So, are you seeing responses in chat either indicate very sick, mild symptoms, or no symptoms for your work setting? Very
We're
sick.
seeing,
Chat.
yeah, we're seeing, I have 2 very sicks. I have 3 no symptoms to, well, 2 no symptoms to mild, and I have 1 response that says no symptoms to very sick. So they've seen that wide variety.
Okay, great. So now let's think about our own experiences at work and talk about what applies for you. So it looks like some of us have worked in a facility that's treated people with COVID with different symptoms or no symptoms at all. So we're going to talk more about that today. And thank you for putting your responses in chat. So how do viruses work? Viruses are able to use cells in living things, including people, to make copies of themselves. When enough virus gets into a person's cells and starts making copies of itself, the body can recognize that there's an infection and the immune system revs up to fight off the virus. It's the activity of the immune system fighting the virus that generally makes us feel sick. If a person is infected with SARS-CoV-2, the virus that causes COVID-19, it can be spread by their respiratory droplets. Those droplets with virus in them are released into the air.
Hello.
When the infected person talks,
Yeah.
breathes.
Can I call you back? Who is this?
Brenda, you're not muted.
I got it.
Okay. Those droplets with virus in them are released into the air when the infected person talks, breathes, coughs, or otherwise blows out air of their nose or mouth, and the respiratory droplets can then land on someone else's eyes, nose, or mouth, or someone can breathe them into their throat or lungs, where the virus in the droplets can start attacking the person's cells. So now, guys, we're going to do a trick here because I have to switch to video mode. So I'm going to stop sharing for a second. And I'm going to pull up the video. And I will share again. And we'll play the video.
Welcome back, everybody, to Inside Infection Control, our video blog here at CDC's Project Firstline. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC, and it's great to have you here today. You may have noticed that a lot of the infection control recommendations for COVID-19 apply all the time, not just when you're caring for a patient that you know has COVID-19 or that you think might have COVID-19. Why is that? Why are steps like source control important all the time? It's because we know that many people who are infected with SARS-CoV-2, the virus that causes COVID-19, don't actually know it because they aren't feeling any symptoms. They don't have fever, cough, shortness of breath, or other signs of disease. And even though they don't look or feel sick, they can still spread virus to other people. How does that work? On an earlier episode of our video blog, we talked about how viruses make you sick. When you feel sick, like with a fever and your cough, that's your immune system that's kicking in to fight the virus. You can check that episode out for more details. We've put a link to it as well in the comments. So if you want more information on that, follow up there. But what's important to remember is that you can be infected with the virus and your immune system can still be working, but you might not feel sick. You may have been infected recently and you haven't started feeling sick yet, but you're going to in a couple of days. That is called pre-symptomatic infection. Or you may be infected and you will never feel symptoms at all. That is called asymptomatic infection. It's not clear why some people have milder cases of COVID-19 than others, or why some people are infected with SARS-CoV-2 and never show any symptoms. But either way, when you're in this state of having the virus but not feeling sick, you still can spread the virus to other people and make them sick. How? Well, the virus in your body is there making copies of itself in your cell and spreading around. So it's in your respiratory droplets. And those droplets come out filled with virus when you breathe, cough, or otherwise push them out of your mouth and nose. It's like when you're yelling or you're singing or exercising. And those respiratory droplets will spread places. They can be breathed in by others, and then the virus can start attacking that person's cells, or they can fall on surfaces where they can be picked up and spread that way. Just one thing to note, although we're talking about COVID-19, it definitely is not the only disease that spreads from people who are infected but aren't showing any symptoms. Another really common one in healthcare is influenza or flu, and it's a problem every year. So to sum it up, what's important is to keep doing the recommended infection control actions, like masking for source control, to keep that virus from spreading, even if you don't know if you have the virus, and even if you aren't feeling sick. That way, you're still protecting other people by having a mask on. As always, thanks for joining us. Please be sure to follow up with us. We're on Facebook, Twitter, and YouTube, or you can meet us on the web, cdc.gov/Project Firstline.
Okay, now I'll switch back to the other mode here. Okay, you guys should be seeing my slides again. So sorry, I hadn't switched to the video slide. So, as we heard in the video, people can be infected with a virus and their immune system can be working and they might not feel sick. Even if they don't feel sick, they can spread the virus to others. And it's important to know and remember this when you're thinking about infection control. Sorry, I got to make sure I'm catching up with myself here, guys. So we have a couple definitions to review, and these are the two ways that people can be infected and not feel sick that Dr. Carlson mentioned in the video. Pre-symptomatic infection means that a person is infected with a virus but hasn't started feeling sick yet, but they probably will soon. Asymptomatic infection means that a person is infected with a virus but doesn't feel any symptoms at all. And as you heard from Dr. Carlson, this can make it harder to control the spread of infectious diseases because people don't always know that they have an infection or that they're contagious and can spread it to others. And you guys kind of, if you have children that, or if you had chickenpox as a kid, your child will have a runny nose. They don't have any pox yet, but they're actually shedding the virus because they're infected and they're spreading that virus at that point in time. You just don't know it. They just have a runny nose that day. So that's kind of what she's talking about here. So let's look at this slide. And it's supposed to have some animation. We'll see if it has animation or not. Let's do a little detective work. And can you guess which of these people has COVID-19 and may be symptomatic or may be contagious? Feel free to type in chat who you think. And you can just do 1, 2, go across 1, 2, 3, 4, 5, 6. And put a number in the chat. Number 4. All of them, somebody said. We can't tell, can we? Lots of people are infected with the virus but don't show any symptoms. But you could guess that this young man right here with his head on his forehead is really not feeling very good. He may or may not have the virus and may be spreading that. Supposedly there's some animation. Nope. Even people who appear healthy and show no symptoms may have COVID-19 and may be able to spread the virus. So there is a little bit of animation in that slide. Did you know that flu can also be spread by people who are pre-symptomatic or asymptomatic? Yeah, you can. You can pass on flu for someone else to someone else before you know you're even sick, as well as while you're sick. And not everyone with the flu will get a fever or have symptoms you may be used to looking for, kind of like the chickenpox I talked about. People with flu are most contagious 3 to 4 days after their illness begins. Some otherwise healthy adults may be able to infect others beginning 1 day before the symptoms develop and up to 5 to 7 days after becoming sick. And some people, especially young children and people with weakened immune systems, might be able to infect others with flu virus for an even longer time. So when we talk about controlling the spread, people who are pre-symptomatic or asymptomatic, who aren't feeling any symptoms, but who are infected with the virus can still spread COVID-19. Why does that matter? How can we use this information in our work? Go ahead and say how you could use that information in your work in the chat. Any ideas? Stay away from everybody? We did that for a while. Need some help? Why does it matter? We can't tell who may be infected and able to infect others. All of our infection control actions are still important, including masking for source control. Because we can't tell, it makes it all important. So, when we talk about what we've learned today, it's time to start putting some of that knowledge into practice. So let's look at, what did you learn today about asymptomatic spread? I'd love to hear from everybody. Go ahead and put in the chat. Have you identified one thing that you'll need to do or continue to do in your work to protect yourself and others from diseases that can spread when people are infected but may feel sick or may not look or feel sick? Would anybody like to share? You guys are quiet today. My script tells me I'm supposed to say thank you for sharing. Continue to just keep everything. I lost it. It went away, Brenda. What did that comment say?
Continue to just keep everything clean and wear a mask.
Okay. Does anybody have any questions? Does any of this raise any questions in your mind that you'd like to ask now? You have an open audience for answering questions. So, and if we don't know the answer today, we'll be happy to address them at a later time and get back with you.
We have another comment that states, or just a reminder that COVID can be spread by simple things such as talking, singing, etc. So it's important for us all to follow precautions no matter what. To remember, you can spread up to 7 days after sick and 1 day before symptoms start.
Okay. Any questions that you guys have? We appreciate people sharing. Project Firstline is actively collecting questions to help inform training resources as they're developing. That's why this particular session that we're looking at today wasn't one of their original set. So they've run with that and created an additional set of curriculum for people. And we can absolutely pass on additional things if you guys feel there are some things that you need in your setting and you would like resources for. We'll be happy to do that. So key takeaways of today are that people can be infected with a virus and their immune system can be working and they might not feel sick. People who might not feel sick or show symptoms at all can still spread viruses. And that's why infection control recommendations for COVID-19, like masking for source control, are in place in healthcare settings and will continue to be so. And unfortunately, in yesterday's update with KDHE, Kansas is red. We have one county that's not red in the moderate or big COVID range. So, and that's Rooks County. So if anybody on the call today lives in Rooks County, you're lucky. You're in the yellow range. The rest of us are all a little more orangish red than that. So we got to keep up the fight. Again, you can go to the cdc.gov/Project Firstline for more resources. And if you, as Dr. said, you can actually look on social media. You can see some Facebook videos. Some of these videos can be shared. You can go find them on Facebook and share them out with others. Can fully vaccinated be asymptomatic and still spread? Yep, you can. Did I read that whole question right? It flashed quickly. Yes, you can be fully vaccinated, get COVID, and still spread. The thing is, though, as a fully vaccinated individual, should you get a big case, you're not going to get as sick as the others do. That's why you can be asymptomatic or not hospitalized if you do have symptoms. So that's all I have for you today, unless you have additional questions. Next time, we'll cover, let's see, I forget what our next session is going to be. I think it's talking more about how the virus actually spreads. So that will be the next topic, and then we'll get into some meatier things about infection prevention efforts and what we can do. Anything else that you guys want to address today?
There is a comment or a question. What are main areas to keep in mind to clean in homes we normally wouldn't think about?
That is one of the things that we're going to cover. That's one of our upcoming sessions. We will be covering that. The key principle in infection control to remember is to clean high touch surfaces, like light switches. If your facility has railings on the wall where residents walk down and touch railings, those need to be cleaned. Wheelchairs, chair arms, things like that are high touch surfaces. And the big thing, and one of the sessions that we'll get into, we'll talk about this a little bit more, but make sure that the cleansers and the disinfectants that you use, look at the guidance for how long those things need to be wet. It talks about contact time or dwell time, and that means that the substance has to be wet. So if you have some wipes that you're using and it says that the dwell time or contact time is 10 minutes, that means you have to be applying that wipe wet, or another one to keep that surface wet for 10 full minutes. So what you really want to look for are things that you don't have to keep wet for that long. Look for wipes that actually have, you know, like a 1 minute dwell time or contact time that also are good for disinfecting the particular surface. And a lot of questions will come in from people about what do I use on certain things? Like, you know, we all have electronic devices and screens and things that sometimes you really do need to reach out to the manufacturer of that equipment, glucometers, things like that, because you need to make sure that whatever you're going to use to disinfect that surface or clean that surface is not going to harm that surface. That's why we're seeing more things about, you know, taking the actual gunk off and then using a UV light or something to actually disinfect because it's not as harmful. So that is important to make sure you look at the dwell time. I did a in-service basically on hand hygiene for C. diff with a group of elders in an assisted living building, and they put out this spread of food for everybody in the in-service, and they had it all out there, and they had a thing of Clorox wipes on the table. And we went and picked up that Clorox wipe, and first thing we said was, do you realize that this doesn't, what do you think this wipe is? And they said, oh, that's bleach. And we said, do you realize there's no bleach in this particular product? Well, it's Clorox. Well, just because it's Clorox doesn't mean it has bleach. It's the Clorox company that manufactured the product. And it happened to be something that, number one, it said no bleach. And then it was one of those things that had to be wet for like 10 minutes. And these little elders were like, oh, that's not going to work. We can't use that. And they literally took the thing and they put it somewhere where nobody would use it because they didn't feel it was really appropriate for what they intended to use it for. So it was educational for them, and they were like, wow, thank you for talking about that. Are there any other things that have come into chat? I've seen it flash a little bit.
Yes, we have a suggestion for us about putting out surveys by email about the content so far, and maybe what kind of topics the audience would like to see covered in questions that we have. So that way we may be collecting those questions ahead of time. And then we have a question about, do you recommend the booster for fully vaccinated people working in healthcare?
That's just a really funny question that you guys are asking, because I got my booster Wednesday and I was down for the count yesterday, but and I just told myself it was mounting a strong immune response, and I'd rather have that than COVID. So yes, absolutely, I would recommend the booster for those working in healthcare. Don't ask me if I would switch to the different vaccine. I stuck with the same one, knowing full well that it was going to cause side effects for me, most likely. But I did stick with the known because I knew what those side effects would be. Yes, the answer is yes, I would recommend the booster. I just think it's the best way we can protect folks. And I think with I personally feel like we will have less breakthrough infection. Once we get boosters, we're not going to see as much breakthrough infection. Any other questions? We have a couple minutes. I'm glad you found the wet contact time helpful. That is definitely something that you have to think about. And I think that's something that a lot of people don't understand. Okay. Well, if you guys don't have anything else, thank you for your suggestions about asking people to let us know if they have any questions in advance and what particular topics they would like to see. We will direct you to where you can find the videos that we're sharing. Those are on the CDC website. And we also need to let you know where the recordings are being posted. They're not out there yet, but they will be. That's all I have. Thank you all for joining us. We're glad that you find this helpful, and we'll see you next Friday.
Yeah. Okay, I got chat saved. No.